Hi, my name is Dan Gomez, and this is Mental Health Super Omnia, mental health above all. We identify and understand mental health issues and the paths for help. Today, we want to talk about ableism in its many forms. We have two guests. First, Laura Mauldin. Laura is a writer, sociologist, and an associate professor in the Department of Social and Critical Inquiry at the University of Connecticut. Dr. Mauldin frequently writes in the context of deafness, chronic illness, and disability. Her writings appear in the Los Angeles Review of Books, Baffler, American Prospect, just to name a few, and she's currently working on a fascinating book, which she gave us a glimpse of, but we haven't been able to read yet. We also have Erica Burgoon. Erica is a member of the leadership team at Equilibria Psychological and a licensed clinical psychologist with 25 years of experience. She provides clinical services across the lifespan and specializes in working with depression, anxiety, and trauma. Laura, we've read many of your essays and other publications, and there's a lot of them out there, but we've read almost all of them, and we were fascinated by the concept of ableism, both in its classic form and expanded into how many have those very same feelings about not being tall, pretty, or handsome. Can you explain for us ableism and its different forms?
Sure. Thank you, Dan. Thanks for having me on. Happy to be here and to talk about ableism. And I do define it in my upcoming book. I'd be remiss not to tell you the title and release date, which is it's called In Sickness and in Health: Love Stories from the Front Lines of America's Caregiving Crisis. And that's published by HarperCollins and out February 10th, 2026. And in that book, I give my definition of ableism, but I am certainly not the first. But my definition is really quite simple and quite broad, which is it's a system of belief that some bodies are worth more than other bodies. Very simple. Now, many other people have defined this and perhaps in more, granular fashion. But I really like to think about it on this really broad level so that we can understand that it's everywhere, in everything, and it often is unmarked because it seems appropriate or reasonable to have certain feelings or assumptions about certain bodies.
Laura, I'm so glad we're able to be here to talk about this today. Um, the many forms of, I would say, bias and oppression. I don't feel like ableism gets nearly as much attention as many other forms, and yet, with an aging population in this country, and we know that there's not a great safety net for people who are chronically ill, for people who are aging. And it is almost astonishing to me that we can, continue to kind of have the blind spots that we do about this. Uh, I think that often when there is sort of like a landmark moment, and the ADA certainly was one back in the 1990s, that we can sort of think that we've addressed these things, that they're not, these are not problematic in the way that they used to be. And yet there continues to just be so many spots that we're just not aware of or that we overlook. And I guess if you could start by talking about some of the ways that ableism shows up that many of us may simply not be aware of.
I am so glad you raised this connection with the ADA, the Americans with Disabilities Act of 1990. Um, a lot of people's definition of ableism is discrimination against disabled people, which is, of course, a huge part of ableism, but it is only one slice of it. But as you mentioned, there has been more attention to things like stigma and bias, particularly in like various health fields, right? Where you're learning more culturally competent care and you're thinking about all of these issues like sexism and racism. But like you said, ableism is really overlooked. I think we don't talk about it in medical education. And we also think, well, there was this law about you can't discriminate against disabled people, so it's taken care of, right? Except I've worked in a hospital for over 10 years, and I continue to have to, as a sign language interpreter for deaf patients, and I still have to educate physicians, particularly residents, when they come in July and we get the new crop and we have to explain how to use an interpreter, that deaf patients exist, that hospitals must provide interpretation, that, there are all these different things that even though this law exists, people don't have the awareness of all the far reaching tentacles culturally, structurally, environmentally, attitudinally that still affect everything. So, what you're bringing up about an aging population who is aging into that category of disability, right? And if we don't have safety nets for disabled people, disabled adults, particularly, even in these younger years, well, people are going to have to then face this in their elder years as well once they age into it. Okay, I forgot the end of your question, but I wanted to put a fine point on everything that you had mentioned because they were all so good.
Sure. Yeah, I was bringing up that, in maybe some of the big and obvious ways with the ADA, right? We have ramps installed in public spaces and door widths widened, but there's still so many invisibilities in terms of the other ways that people may face ableism, may face obstacles when they're living life with a disability, or in a body that's changed by age, illness, or injury.
Yeah, and I think it's really important too to think about the different levels. Okay, so I'm going to put on my sociology hat for just a
Mhm.
minute because we often think about things in society at the micro level, the meso level, and the macro level,
Mm.
right? So we often think about things in that way. And when I think about mental health care and ableism and barriers, I want to start with that sort of macro level piece where, yes, we may have the ADA, a federal law. Sure, we may have that. But we also have a system in this country of care, of health care that is based on employment.
Mm.
That is rooted in ableism because ableism means that we devalue certain bodies, right? So if a body isn't deemed normal, isn't deemed productive, isn't deemed able to work, there's this kind of neglect that is justified because if you don't work, I think just yesterday there was like a town hall where some senator says, well, do you want this 28-year-old able bodied person to still get health care and not be working? And there was this resounding sort of protest from the audience that I was very pleased by that were like, yes, we do. We do want that person to still get health care. But in this country, on this macro level, we have a belief system that the people who deserve access to health care, including mental health care, are only people that can work, have normal bodies, are productive. This is ironic, of course, because the more we deny care, the more disabling we are for the population, right? As people don't get access to um, routine healthcare, for example, then that can turn into a catastrophic health problem later and result in disability, result in trauma, result in all of these different things. So the irony, right, is at this macro level, we actually create more disabling conditions while also sort of neglecting a certain part of our population as, oh, well, you don't deserve care, so you don't get access to care. So that's a major sort of macro level issue. At the meso level, this has to do with things like paid leave, things like the FMLA, right? The Family Medical Leave Act. That only covers, I believe, up to 12 weeks or something like this. And a disability doesn't go away in 12 weeks, right? And that's just not something that at that meso sort of employer level can take care of those kinds of things. But we don't have this built-in system or safety net, as you've mentioned. We don't have home health care for disabled and elderly folks. Well, what we do is atrociously inadequate, but
Inadequate.
we do have some programs that are really means tested and they're poverty-based programs. Um, and then I'd like to really kind of home in on the micro level
Yes.
because there's something called internalized ableism. And this is something I'm particularly thinking about Kathleen Bogart's work. She's a psychology professor at Oregon State University. And one of the things that she writes about is how when someone becomes disabled, if they actually begin to think of themselves as part of a disability community
Mhm.
and have a disability identity and come into this sort of knowledge that they aren't bad, that they aren't the problem, that they're part of something bigger than themselves, that is the process of sort of getting over, getting through internalized ableism that tells you I'm bad. I am the problem. And it results in copious amounts of shame, um, and avoidance of perhaps getting the care you need. And when we don't know what ableism is, think about becoming disabled. I remember one man that I was talking to, he had a stroke, and lost the use of one side of his body. And he was crying and telling me, I'm useless, I'm worthless. All I do is sit here and take resources. I don't contribute anything. I'm not worth anything. And that is ableism telling him that because you became disabled, you are now worthless. He has taken that sort of ableism that's in the ether that we just sort of think is appropriate and reasonable. Well, yeah, certainly if you're not producing something for the economy, well, yeah, you're not worth anything. You're worth less. We easily diminish people. Those kinds of messages get internalized. We all take them in, disabled or not. And that I think it's really important to know that ableism affects all of us. You do not have to be disabled to experience it. And I'm certainly not the first person to say that. But one of the things that happens then at the mental health care sort of moment is people may not have the language to talk about how they're feeling. They may not have the language for that or to know that they're not bad, that there is a larger sort of systemic thing going on here that has resulted in them internalizing this sense of shame and worthlessness, which of course contributes to so many other things, right? A lack of self-esteem, depression, anxiety. There may be trauma associated with how they acquired their disability. There may be just ongoing medical trauma related with, ongoing long-term chronic conditions that require a lot of interventions. So that internalized ableism is a really big piece of it that really affects whether or not people seek mental health care or how they can talk about what's going on with them if they're trying to cope with becoming disabled.
If I could interject just a little bit, Erica and Laura, um, part of my issue, if you will, on this particular topic is that um, on one hand, I completely understand, and I have examples where I personally have internalized ableism and where I felt bad because something happened to me, like mental health issues as a result of that. On the flip side, though, we do have a system where we are a productive, very productive country, and we are, arguably the number one country in the world right now, right? We have a system that is kind of a patchwork, right? Um, you do get many people get their insurance through work, of course. We had people that paid for insurance and then people that didn't have insurance. The the Affordable Care Act tried to solve some of that. When it did, it shifted costs away from the younger, that 28-year-old able-bodied person who didn't have insurance, who probably could have gotten it on the exchange for $250, and they made it more expensive for anybody 55 and older, to where some of those people are spending as much as $1,800 a month for a gold plan, a top tier gold plan. So the system may not be perfect, but I almost feel under attack just with the whole concept of ableism, even though there's times where, like I said, I've gotten hurt, and I have mental health issues as a result of not being like everybody else. It's kind of a sense of worth. Isn't that a human thing? Right? That's where I get a sense of worth for actually doing stuff, for helping people, for creating things, for providing for others.
Yeah.
So if I can't do that, I mean, why wouldn't I have mental health problems?
Yeah, absolutely. There are all kinds of ways that we acquire a sense of self-worth, right? There's so many ways that we do that. And you're right. We have a country that is sort of built on this culture of productivity and contribution, right? To be thinking about contributing to society in this way that is measurable and quantifiable. Um, and I think what often happens with disabled people, and I'll just, think about some of the just disabled friends I have, disabled people I know, who may have so much to contribute, but it may not be deemed economically valuable. It may not be something that can be, well, there's also rampant, sort of discrimination and employment practices. Disabled people have really struggled to close the gap in unemployment rates and things like that. So there's these other sort of barriers that can sometimes affect disabled people. And not all disabled people are affected equally. So disabled people of color, women, there's lots of different ways that people are affected on these different levels. But what ends up happening is there's these sort of conditions that sort of tell us that what we do have to contribute isn't valuable, and it's hard to find self-worth in that. At the same time, and people may not know this, but there's lots of disability communities all over the country. And there is a movement called disability justice where a lot of folks actually operate outside of the state and think about providing long-term care for each other and contributing in a more of a barter system, referring to that as collective care. So in that regards, people start to contribute in their community with one another. Oh, I can contribute by cooking that meal. I can contribute by sitting with that person in those hours when they're going to need care. And there's not a paid person to do that. We don't have money to pay people to do that. So there's these ways to contribute that require sort of getting creative and operating in these other ways that we don't usually or typically think about. But it is absolutely a human experience to need to feel productive and that you're contributing to something. And I think often for disabled people, especially as they get older, and I know this is part of ageism generally speaking, that older people can think, oh, I'm a retiree, I'm not sort of contributing anymore. And we tend to minimize their worth or their value as they get older. So there's lots of ways that this comes up. And I would just say to your point about the systems, those are I think there's this sort of internalized piece that I'm very much talking about, that sort of micro level individual feeling and struggle and how people try to cope with that. But I think what's just necessary to locate is that that internalization comes from a really long, embedded, entrenched history in this culture, in this society of how we decide on care policy, how we decide who gets care. Like those big patchwork systems came from somewhere. Those decisions came from somewhere, from some kind of belief system that said, oh, we're going to set it up this way. So there's whole histories on how, the fight for Medicaid, the fight for Medicare, the fight for the ACA, the fight, like all of these different things happened not in a vacuum, but in a sort of cultural, historical moment where we made decisions about who we think should receive care. And so we can't necessarily do anything about that right now. I think what, especially in my book, I'm trying to do is show people that there's this larger thing happening, but it affects us individually in these really deep, intimate ways, how we feel about ourselves, and thus how we feel whether or not we deserve love, we deserve care. And that means from our partners, from our family members, or getting mental health care, any of those in any of those ways. So it is human, but it is also a very specific flavor of something happening that's connected to a larger history, a larger cultural piece. And we don't necessarily have to have a whole lesson on that, but it is helpful to locate our feelings as part of something bigger than us so that we don't have to blame ourselves and our bodies for what they're doing. And when they're just being human, our bodies are meant to decompensate over time. That's what they do. We're fallible. And we have a really hard time accepting that, I think.
Erica, do we have examples, or do you have examples of where other people's perceptions of somebody that perhaps was disabled or was not as quick, not as fast, not as pretty as somebody else, were verbally told that they were an inspiration, or that in some way made those people feel bad even though they didn't mean to?
Well, it sounds to me like one of the areas you may be hitting on here, Dan, is that Laura's been speaking, you have been speaking, Laura, about a lot of cultural narratives I think oftentimes a hallmark of a cultural narrative is when we're embedded in the culture, we kind of, it becomes invisible and we adopt it, we internalize it. And I've noticed that one of those cultural narratives too is this idea that we can overcome all challenges, and also a narrow definition of what it means to overcome. And
Yes.
so I'm thinking of some folks I'm familiar with both through my professional work as well as in my personal lives, where they may be living with a disability. And one of the things that they've shared with me is, in essence, I didn't sign up to be anyone's inspiration. So they get these messages like, oh, you're so brave, or you're such an inspiration. And they don't necessarily find that helpful. And
Yeah.
I don't want to overgeneralize. Other people living with a disability may feel differently, but almost like this desire to see them overcome, again, in a way that's pretty narrowly defined. And I think about that as a type of ableism too.
Oh, you're so right. And you also make a really good point. And that's why I used specifically the plural disability communities earlier, because it's not a monolith, right? I mean, disability is just such a huge category. It can be mobility, it can be cognitive, it can be sensory. There's so many different impairments that sort of fall under that. So we can't generalize. You're right. But I do think that that inspiration piece is absolutely a sort of form of ableism because it betrays the pity and the low bar of, oh, if you just go outside, you're brave.
Mm.
I've been with friends who've told me about people coming up to them and they're a wheelchair user, and somebody will say, I would kill myself if I looked like you. Literally, people, strangers on the street, just saying that. Um, and so these kinds of things are invisible because we think it's appropriate. That people think that it's appropriate to say that you're an inspiration, or I would kill myself, or think about, I think it was this film, Million Dollar Baby. Hilary Swank plays this boxer, right? And the end of the movie is, oh, what's his name? Oh, Clint
Clint Eastwood.
Eastwood. Yeah. Clint Eastwood pulling the plug on her because she's, I think, quadriplegic after an injury or
Yeah.
something. And that's the happy ending, is that he's put her out of her quote unquote misery.
Mm.
Which, think about that you're better off dead.
Yeah.
That came up in my research in my book too. I had one of the one of the men that I interviewed as he was leaving rehab after his sort of 6 week stay. The only resource they sent him home with was a suicide prevention pamphlet. So there was no like, you're a disabled person now, there's other disabled people, there's life on the other side of this, there's so many ways to be disabled, there's so many things for you to know and people to connect with. Rather than that, it was, well, you might prefer to be dead. But we don't really want you to do that. Here's this, suicide prevention pamphlet, which is horrifying, right? but we think it's appropriate. So there's so many ways that this comes up. I remember too, we often think about, and then I'll be quiet. Um, I remember when COVID sort of started and the Social Security Administration was really overwhelmed with
Mm.
long COVID claims and needing, respite from work because they had long COVID, and there was just sort of this catastrophe sort of brewing with the budget for the SSA and what people needed in the wake of having had COVID. And I remember there was an announcement that SSA was sort of getting more resources and was going to try to meet these needs. And I was having a conversation with a family member telling him about, oh, this news piece that, the SSA is going to expand their funding for this to meet this need. And his response was, well, I guess that's good, but I don't want people to find out about that and then go and try to get that money. This sort of sense that there's like these marauding people out there trying to fake it. And that's part of disability too. That's part of ableism too, is that assumption that you can't be trusted, that it's untrustworthy in some way, that it's when you look at the Social Security Administration's sort of fraud rates, it's less than 1% when you look at their actual data. And when you talk to people, as I did for my book, about how to qualify, um, as disabled under the SSA, it involves paperwork that is so mountains, like file boxes, multiple file boxes of getting your hands on every piece of documentation you can that has to do with your medical condition and your financials. And you don't have to do that once, you have to do it yearly. You have to get recertified constantly. And it is a lot of work. We talk about that, sociologists talk about that as administrative burden. And there's a disability law lawyer who talks about it as disability admin. Liz Emmons talks about this. And it's part of our response to what we think of as the disability con. Another lawyer, Jerome Dorfman, who's a disability lawyer, writes about the disability con, this belief that it can't be real. And a lot of that has to do with, well, if other people's disability is real, then I might have to face my own fallibility. I might have to face my own limitations. I think there's something psychological going on there that we can't sort of accept disability as a normal, routine, absolutely expectable part of life. It
I
just
think there are
is.
so many human experiences that the collective we, especially in this culture, with this belief in personal responsibility, that we believe if we do the right things, we won't end up in that position. And I think it's something that allows so many of our biases, both the ones we're talking about today and many others, to exist and continue to exist.
I really like that point. Yeah.
And you shared so many, so much information about the challenges and the obstacles that people in the disability community face. And as you were, I was thinking about, how the challenges we put in place for people with all kinds of disabilities, including those that are very visible, but how many people live with disabilities that are not visible? And you use that phrase that I appreciated, disability con, as if folks are out there trying to get one over. And I was thinking of so many examples of clients I've worked with and people I know in my personal life who face exactly what you describe. For instance, maybe are pursuing some benefits because of neurodiversity and autism diagnosis, let's say, that makes communication or social interactions difficult, and then are required to sit through hour-long interviews as part of the application process.
Yeah, that itself could be its own barrier so that people who
Mhm.
need, yeah, they can't actually do the thing that helps them get what they need.
Access what they need, exactly. Yeah. Um, you had used the phrase before. I really appreciate it. There are so many ways to be disabled, and I know, hopefully, I quoted you correctly there. Certainly, that's true in terms of type of disability, but I assumed you were also tapping into ways that people may choose to live their lives with their disability, and that there's such a range of valid. But we, again, I think as part of ableism, we don't always see it that way, and that we tend to see that there are right things to do and not right things to do. When we were, kind of talking earlier about that idea of being an inspiration, I guess as an extension of that, I've talked to folks who have talked about like almost this, uh, I guess what some people have called toxic positivity, like
Mhm.
these narratives about, we're never given more than we can bear, and you will rise above this. That there is, if, especially for acquired disability, you've acquired this disability, and you will go out or the expectation that you will go out and whatever it means to rise above. But again, I think that's pretty narrowly defined in our culture.
I think there's that too is also like it is ableism and it's also this, I think, psychological impulse, this to, oh, well, if that happened to me, I would want to be able to just do XYZ and then everything would be restored, right? There would be restitution through my excellent, whatever I do, my diet, my exercise plan, my whatever, that we sometimes, when we don't have language for ableism and we don't have a way to talk about it and we don't have a way to put language to our shame or our hesitance to get the care we need or anything like that, when we don't have that, we sort of respond in this sort of lizard brain, like, oh, if this was me, then I would want to have this off ramp, right? And so I'm just going to tell this person that they're going to rise above, they're going to do this thing and it's going to be fine. But that's about our own discomfort.
I really appreciate that. I agreed. Yeah.
And that's really hard. And I'll give a personal example. Even just, I live with a couple of non-apparent disabilities, and whenever I'm sort of down for the count and I have to like be in bed for 2 days, um, I say to my partner things like, "Oh, I'm so sorry. I'm just the worst. Uh, I I'm putting all of this on you because I'm here, with childcare or whatnot, and I'm not contributing how I would normally contribute, which is how I get my sense of self-worth, like we all do." Um, and my partner just looks at me and says, "Do you read anything that you write? Do you read it?" You know? And so I think some of the things we're talking about are really kind of intellectual in a way that can be just like with any other therapeutic process, right? It's easy to kind of intellectually understand that this dynamic is happening, but it's much harder to make that emotional shift and to actually internalize a counter narrative that you either had never had access to or just don't have practice, you know, operationalizing in yourself, right? Because we just don't have that kind of culture.
So let me try and understand and give you a specific, or we'll generalize off of a minor example into something that's more serious. So I broke my ankle years ago. Just by way of reference, if we were walking down the street, I'll guarantee you right now, neither of you would be faster than me. Okay, I kind of like walk like New York fast. Okay? It's just what I do. So consequently, my wife's always telling me to slow down. Kids are always telling me to slow down. Grandkids are getting dragged along. The whole ball of wax. I broke my ankle, and when I broke my ankle, I couldn't walk. Okay, it took me a while to get back to where I needed to be, and so I actually kind of got, if you will, a little depressed about it. And I even told my wife that I felt like I was being culled from the herd. Now, the reality is, I did physical therapy. I worked at it. I worked at it. I'm back to walking faster than everybody else, etc. Okay, so I'm very happy about that. But there's people that don't get better. They, in fact, end
Yeah.
up living with that disability, that issue. So if someone who is able-bodied had a minor little scrape that caused me to not walk as fast as I normally do, or not walk first and then not walk fast like I normally do, felt like I was being culled from the herd. What does somebody who has that on a more permanent basis or periodic basis throughout their life, what do they do? Where do they because mentally it's a strain on them. So what do you do to get help? Are there groups? Do you go to ministers and rabbis and priests? What friends? What do you do in order to feel better, to feel like you're part of society again, or to be
Okay,
happy with where you
I
are?
have I have some thoughts on that question, but I want to ask you a follow-up question.
Yes.
I'm very curious about your use of the phrase culled from the herd.
Yeah. That's actually what I uttered to my wife, by the way.
I'm so curious about this. I think that tells us something. What does that mean to you to say culled from the herd?
Well, first of all, I'm probably the only one on this call that was born in Kansas. Okay. So I know a little bit, just a little bit
Texas, not too
about.
far. Texas.
That's true. Okay, fair enough. Fair enough. I know a little bit about animals and whatnot. And when you imagine this group of animals, whether they're human or they're cows or they're bison or buffalo, whatever, that are zipping along, the ones that die are always the ones that straggle, that are different, that aren't attached to the group. It's kind of like if you're a fisherman, there's a bait ball. Why do fish create a bait ball? So that they can appear giant, okay, and
Yeah.
try and keep other fish away. And the ones, sometimes the bigger fish will dive into the bait ball and get other fish, but they certainly pick off the ones that are on the outside. So literally, I felt called from the herd because I was
Mm.
no longer in the herd. I wasn't leading the herd and walking. I wasn't in the center of the herd. I was back here. My wife, to her great joy, was dragging me along.
This is so interesting to me because what you're describing, um, of course, in animal populations, they don't have the kind of cognitive capacities that we humans do to sort of make different choices for different things. They're sort of moving along in their instincts, right? And you're right, sort of that's the stragglers sort of just die off. They don't have health insurance systems or like systems of care necessarily that would take that into account. And I think what you're describing is less about I think that you experienced it as an individual, as the outsider, as the one left behind. But there are social arrangements that created that feeling. And what I mean by that is sort of, and forgive me because I do sort of move in and study and am part of disability communities, and particularly in disability justice worlds, there's a phrase that says we move at the pace of the slowest person so that we rearrange ourselves such that no one is left behind and no one has to feel culled from the herd. In fact, we reshape the herd to surround that person. And so, one of the things that I would say to sort of answer your sort of endpoint question, which is what do people do when they just are disabled for the rest of their life? They just, this is it. The people that I know, just from my own social circles, bond together with other disabled people across impairments so that there's solidarity across. It could be, I know one person who uses a cane, another person who uses a motorized chair, another person that uses a manual chair, another person that is deaf, another person that's blind, and they all sort of find a way to create community with each other. And it is in the daily affirmations that you are cared for and loved in this space, and we rearrange ourselves to meet all of the needs that no one needs to feel culled from the herd, right? Just to use your phrasing. But that is something that is much harder to do on this sort of large scale, total rearrangement of our entire society that, I live in New York City. It's like go, 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 productive, productive, productive. There's this real sense of, we leave people behind all the time. I got to catch the train. I got to do this. So I think the answer is, and I think this goes back to some of that research that I was sort of calling out from the psychology professor, Professor Bogart at Oregon State, is precisely why what she has found is that when people create these connections with other disabled people, um, that they share knowledge, that they share political affinity, that they share a sense of, I am not bad. It's just that the world isn't designed for us. That disability identity development actually has been shown to mitigate and lessen anxiety and depression in disabled people. It's actually a predictor for lower rates of anxiety and depression, which is amazing, right?
And as you're speaking about that, Laura, I'm thinking about some of your, whether past work or maybe past interviews I've seen with you where you've addressed deaf culture and deafness as a disability. And I think maybe I was carrying into this interview almost like an either or versus mentality. The way I'm hearing you speak about it now, I'm wondering is that that both may coexist for many people to be part of a, as you said, disability community, disability culture, and but still acknowledging the disability as it exists.
Absolutely. Absolutely. There's, as we've already sort of established, there's so many ways to be disabled, and some people move in those disability communities and some people don't. In fact, research shows that most people that count as disabled by the census, the WHO, whatever the CDC, whatever sort of entity is making those definitions, that most people who qualify or meet those conditions to be labeled as disabled don't actually identify as such and would never. There's this sense of one of the people in my book refused, I am not disabled, even though, long-term, chronic, very serious medical problems and mobility restrictions and all these things that were never going to go away. And in our conversations, he said, okay, with you, I'm sort of thinking about using the term chronically ill, but I'm still not sure about that, right? That there's this struggle because, and what he said to me was, once I say it, then I become it.
Mm.
And that's ableism too, is that disability is bad and we don't want to be associated with it. So if we talk about it, then that makes us bad. And that again is that internalized ableism that tells us it's a bad thing. So we don't want to associate with it. So we try to do things to pass as able-bodied or do things that sort of help us feel like, well, I'm contributing anyway, or I'm still productive, even at the price of our own mental and physical health. We may keep pushing and pushing and pushing because everything about this concept of disability is bad. And so even though this is harmful, I'm exhausted, I'm depleted, I'm physically experiencing these symptoms from burnout or overwork or whatever because we've pushed beyond our limits, because that's what often in workspaces gives us value. Um, we experience those consequences as that's the price of doing business, and that's how I can avoid ever becoming that bad thing that associates with disability. And there are consequences to that mental health wise.
This is really resonating on a personal level. I am a person who lives with a chronic illness that classified as a disability, and I have stared at forms before where I'm asked to check a box, and to this point, I have checked the no box, and I'm fortunate to live with minimal to no functional impairments at this up to this point in my life. But I am aware that the illness could change or progress at some point, and so I have had that internal dialogue with myself that, if my functional status changed at some point in time, would I ever be able to allow myself to check the yes box, if that was more appropriate, or kind of like the person that you just referenced, how would that impact me psychologically if I made that shift at some point in the future?
Yeah, I mean, that's such a great example. And I think there's that psychological sort of discomfort with it. But then there's also the question of what counts.
Yeah.
Like, am I
Am I disabled
disabled
enough?
enough? Yeah. And that too can be ableism. I mean, it can be a form of internalized ableism. I mean, I talk about all this stuff. And a few years ago, I was profiled for the organization Stat News. So they report on technology and medicine. That's their kind of journalistic area. And the person who was profiling me says to me, "So are you disabled?" in the profile. And my answer was, "I don't know." Even though I talk about these things because I still question my own, am I disabled enough? Does that count? It's non-apparent. I have flare-ups. Hmm, I don't know. And it is a question that I think is both it's it can be ableism, but I also feel like, well, maybe it's just that I don't want to um like step on anybody's toes or claim something that I shouldn't, or I mean, it's all so murky and conflicting. And I think again, it's probably a result of just not really having a language for this and just that broader culture of ableism that says these are kind of shameful things. We shouldn't talk about these things. And so, therefore, we're kind of stuck individually trying to make sense of it. And I think that's probably why the disability identity piece and the disability community piece is coming out as so important in research.
I wanted to ask, you've done a lot of work with families, caregiving for a disabled family member and couples. And if you could speak a little bit more to that experience, maybe the experiences of the non-disabled partner, but also how ableism can play out in those intimate family relationships.
Absolutely. Some of my earlier work was on mothers and mothering children with various disabilities, in particular deafness, but not limited to that, but that was sort of the majority of my work. And what I found was that that sort of cultural system of ableism ended up internalized by mothers as, oh, there's something wrong with my child. Number one, it's wrong and bad. And that logic leads to, I have to fix it. And that logic leads to, okay, and the best way to fix it would be through these medical interventions. And then there's this whole therapeutic culture and expectation that involves a lot of care labor, right? So making appointments, coordinating care, sitting at the doctor's office, so much becomes, you get sort of wrapped up in this whole world and it takes time. And because we don't have, we don't have universal health care, you don't have universal child care, a lot of this labor falls on mothers. And so that I wrote mostly about mothers because when I was doing my ethnographic work in clinics, that's who was there.
Mm.
95% of the time, it was the mom. I think I met one dad, which is, great for that person. But this was just a pattern, right? That this care is gendered. One of the things that was driving this need was it wasn't that they didn't love their child, not at all, but they were motivated by this sort of cultural narrative, this script of you have a child, there is something wrong with them, you must therefore fix them, and you must engage in these things to do that fixing, right? And that often people would work with their children sometimes to the, degree that they might miss out on just being with, right, rather than working with, right, in terms of like therapeutic interventions. So that kind of can play out in our relationships because how do we feel if we're being constantly worked with, How does that make one feel? How does that sort of, I haven't I would love to see those studies on looking back and having disabled adults talk about what that felt like to be moving through that kind of world. And a lot of deaf people have written about that, um, memoirs and such about being sort of pathologized in that way. But of course, it's not coming from a bad place, right? It's just there's this. So I sort of blame this larger system or culture that's having people react to disability like that. And I've done some research with siblings who actually reported the higher care so siblings of folks with developmental disabilities specifically was this data set, and showed that the higher care responsibilities, the more they saw their sibling as a positive in their life, which you might have guessed otherwise, right? So that was interesting to think about this kind of the capacities for relationships to flourish, even in the context of one person needing what we might consider too much care, right?
Mhm.
Oh, you need too much. It's not reciprocal, right? There's something unequal. At the same time, my research with spouses, it gets very tricky because when one person, well, we think about the spousal relationship, number one, which is something that we sort of hold up as giving us everything. That's the thing that makes us lovable when you find the one, right? And the sort of ableism that courses through that is, well, when one person can't do certain things anymore, there is a whole host of complex feelings on both sides of that dynamic um, that, again, I don't think are necessarily bad, but are certainly manifestations of this larger culture that tells us that disabled people aren't worthwhile, and on that broader level, abandons them. So there's not, for example, universal long-term home care. Who does that care in the spousal relationship? The non-disabled spouse. But we also know that over time, about 30% of those spouses, through those care demands, from the burden of being abandoned, not the burden of someone needing care, but the burden of being abandoned to do it alone, actually disables the non-disabled spouse over time. And I even saw that in myself. I had PTSD after caring for my partner who passed away. I cared for her for about 5 years. So, and there were profound mental health effects for me. So it's a shared load. When the ableism is sort of in our culture and seeps into our most intimate relationships and teaches us that we might not be worthy, and also teaches us, well, you're the spouse, you're supposed to do it all and you're abandoned by the state to do it all, there's devastating consequences physically, mentally, emotionally for everybody involved.
I appreciate your point, and then from a long-term perspective, I absolutely know from family experience the negative impact on the person that is providing care. Okay, my mother with my father who was sick for 10 years, diagnosed, you're going to die in 6 months, lasted 10 years. That process was just, it was brutal. That said, in the short term, in my spousal relationship, if one of us isn't doing well or doing well for some period of time, the other one picks up the slack. That's what we're supposed to do. That's what we do. Whether we're supposed to do it or not, that's what's just what we do. Okay. Whether that's an societal expectation or not, I would do that for my wife. My wife would do that for me, and there'd be no question. I have people in my life that are neurodivergent, have autism, right? When you talk about providing, understanding the diagnosis, getting diagnosis, understanding the diagnosis, and then fixing it, the parents that ended up getting that diagnosis for their child certainly had a very difficult time and had to adjust to it. But then they did in fact flip into fix it mode. And with autism, in some cases or in many cases, having that ABA therapy actually seems to help significantly. So you want to do that, right? So it's not necessarily ableism in that regard is not really a negative per se, is it? And it's just like part of the way we exist.
I see what you're saying. I think, again, this goes back to all the different ways there are to be disabled. And that includes to what extent you utilize interventions, whether that be medical technologies, mobility aids, whatever thing it is that helps you. And yeah, there's absolutely room to engage those things as you see fit and feel are needed. And people do that all the time. I have a friend who has CP and talks about his physical therapist and his prosthetics and how they're like the greatest things that, make his life work. And I think about, excuse me, my own physical therapy. I mean, PT is like my home away from home. And I have long-term relationships with my physical therapist, but there are ways that we can engage with such things without sort of betraying any sense of our worthiness as an individual with a particular condition. Absolutely. One does not sort of preclose, preclude the other. So there's so many different ways that we can engage with these systems. It's part of just, I think, being aware of that we are making choices within a broader culture that is saying something to us, and how can we make sure we're engaging in the most thoughtful way that is the most caring for both the people who are disabled and the people who are tasked with caring for them. So there's a lot of ways to do that. And, I don't think anybody should listen to me on policy. I'm not like a policy person, but there are ways that we could make things better and different for everybody that would require that sort of acknowledgement of disability and the need for care. And I don't think there's anything ableist about acknowledging disability and a need for a certain kind of care. I don't think those things are opposed at all.
Yeah, Dan brings up neurodiversity, and right, so in my corner of the healthcare world and mental health, and it's certainly not limited to neurodiversity, but that is where the conversation takes place a lot about affirming care versus a more historical fix-it care. But I appreciate you speaking to, this is not an all or nothing proposition, and the importance of autonomy and agency of the person, of the family, to say, like, what areas would you like to work on? Are there areas that you could use more solutions, support, accommodation, and other areas that you may embrace, tolerate, accept? And what are, as you said, there are many ways to be disabled.
And it's so important for like mental health professionals or providers to know this stuff,
Mhm.
right? So that they can provide that kind of care and that kind of guidance, and be attentive to these larger issues around ableism so that we can encourage that kind of thoughtfulness about it. And disability doesn't have to be a bad word.
So Laura, Erica, our time is going to come to a close, and I don't want to overstep the time that I asked each of you for. Erica, perhaps you could take a minute and sum up what you need to what you'd like to say, and then afterwards, Laura, I'll ask you to do the same. I'll do probably a 30-second version of that and then close. Erica?
Well, I think I'm going to use my time here. I know there's nothing simple about what we're talking about here. And so I certainly don't want to ask Laura to oversimplify it, but I often find it helpful to end on an actionable step if the listener wants to take one. So if someone is listening to this today and thinks, like, I have something to learn here, what can people do to increase their awareness, to educate themselves? Laura.
Yeah, I mean, I think sort of my takeaway message is that ableism is everywhere. We often don't realize it. It goes unnoticed. It's rather invisible. That it isn't just about disability discrimination. It's also about deeming some of our bodies and needs as worthy or not. Um, and maybe the question is, what is to explore, what is your relationship to disability? Think about your own perhaps conditions or impairments. Like earlier, we reflected on our own, we both talked about our own sort of things. And maybe think about how that word disability makes you feel and why. Maybe investigate, I'm going to be sort of old. I'm going to be like an old person right now. And there's tons of Facebook groups and subreddits on particular conditions, but also on disability community. If you even just look at those and you start to see that people are out there talking about their condition, talking about disability in a positive way, in a supportive way, and that can help create that community. So it might just be a matter of having a little bit of an opening in yourself to think about what is my relationship to disability? How do I feel about it? And how might I explore that for myself in a way that sort of reduces that shame?
Thank you.
And Laura, do you want to tell us a little bit more about your book or summarize for us in some other way?
Well, I'm super excited. I can't wait for February 10th, 2026, which sounds really far away. But I'll just say this, that the book is extraordinarily narrative. It tells stories above all. And peppered in with those stories is sort of a little bit of context, just in the exact moments when you need to know that, hey, this is happening to this person. And if you see yourself in this situation, it's likely because this is coming from something bigger and it's not just you. You're not alone. And so that's the big thing for me with my book is helping people feel less alone, whether they're the caregiver or the disabled person.
Well, and let me just say, from my perspective, I've seen substantial need both from a caregiver or a spouse or a family member, as well as from the person that needs help, short-term, long-term, as the case may be. And I've seen where medical professionals have offered up groups, offered up education, offered up therapy or recommendations for therapy. And those that have taken advantage of it, I think have ended up a little bit better off, if you will. And so I would encourage everybody to be thinking about that. I would like to say that if I could, I want to appreciate both of you being here with us. Our title sponsor is Equilibria Psychological and Consultation Services. They have 7 offices in Philadelphia. Their mission is to help individuals achieve their personal potential and long-term growth. Visit equilibriapcs.com, equilibriapcs.com. Look for them on Facebook, Instagram, and LinkedIn. Also look for me on Instagram. I'm a little bit of a newbie, but nevertheless, Daniel J. Gomez 24, and LinkedIn. Now for the disclaimer. I am not a medical professional, nor am I providing medical advice. The opinion of our speakers are solely theirs alone. This podcast is copyrighted and cannot be reproduced without the express written consent of EPCS Management, LLC. Again, thank you to both of you.